So we're going to recap last week, just to bring us up to today. Next slide. So what do we remember about sickle cell? It's genetic. You don't catch it from someone, it's passed on from both parents, have to have a defective gene, and they pass that on to their child. It is worldwide. Sickle cell was in places where malaria was endemic, places where malaria occurred: sub-Saharan Africa, India, Southeast Asia, Mexico, Brazil, South America. And what happened is when migration happened, when slavery happened, slaves were brought from these areas all over the world. So sickle cell was taken all over the world. It's not one disease. Last week we discovered we had someone here who had SC disease. We have several people who had SS disease. We have someone who has S beta plus thalassemia disease. What does that mean? That means that one parent had the sickle gene and the other parent had an abnormal hemoglobin. And so when that sickle gene and that abnormal hemoglobin gene, when they came together, that created sickle cell disease. So you can have a parent that has S trait and a parent that has S trait, the person will have SS disease. You'll have a parent that has the sickle trait. You'll have a parent that has beta thalassemia. That beta thalassemia and that sickle cell gene got together, so that's S beta plus thalassemia. Someone had an abnormal C hemoglobin. The other parent had the sickle gene. So that sickle gene and that abnormal C hemoglobin came together. The child was born with SC disease. So it's an umbrella of diseases. It's not just one. And when I say it's not just one, I say that to say the presentation for everyone is different. There may be an overall, some overall conclusions we can make. Most sickle cell patients have some pain, most, but not all. Some patients have gone their whole lives almost before they're even diagnosed because your symptoms just don't kind of fit. So we're going to test for all this other stuff instead of testing you directly for some sickle cell disease. But it's different. Some people are hospitalized. Some can manage it at home. Some have really many complications of sickle cell. Some have very few. And you could have the same type. It affects everyone differently. So if person A says, I'm having pain, and person B says, well, I'm not, you can't say to A, oh, well, you're not having pain because this person has sickle cell and they don't have it. You cannot make any assumptions. You take them for face value. So today we're going to talk about inflammation. But these are the reasons that there's complications in the disease. There's inflammation. We'll talk about that today. We'll talk about oxidative stress. Sounds like a big word, but it's not. You've heard of free radicals. You've heard that people say, oh, well, I'm taking vitamin C because it's an antioxidant. We'll talk about that next week to make it clearer. Hypermetabolism. I explained that a little bit last week, but our last session will get more into that. That just basically means that your body requires so much energy just to produce cells, normal cells. We're going to briefly talk about the medications that are prescribed for sickle cell. And I only want to talk about it briefly because that's what doctors are prescribing, healthcare professionals are prescribing. But we want to get your mind focused on the medications are good, they have their place. But eating healthy, whole foods has their place as well. And then, what is it? Hydrate. We talked about that last week. What I didn't mention is how do you know how much water or fluid to drink? How do you know if you're drinking enough? It's a simple equation. You take your body weight in pounds. So I'm going to lie and say I weigh 125 pounds. Okay, thought I look it anyway. You cut that in half, okay? So half of 125, what is that, 62 and a half? So let's round to 65 just to make it easy.
Okay.
So 65 ounces of water or fluid is what I should be drinking in a day. This thing right here is what, 16 or 20? So how many of these should I drink if I'm supposed to be drinking 65 ounces? I'm gonna make it easy. If it's 16, it should be 4. Okay, so 4 ounces of fluid, preferably, water, tea. Kind of stay away from coffee because coffee is kind of dehydrating. And when I say tea, I mean like herbal teas. Some teas, green teas, have a high caffeine concentration if caffeine doesn't bother you. But caffeine is dehydrating. Okay, so yes.
What about the vitamin coconut water? Can we do that or?
You can do coconut water.
Okay.
Sure. As long as it doesn't have added sugar.
Okay. It didn't taste like it.
Coconut water is good for electrolytes.
Yeah.
Actually, it's really good. Okay, next slide, please. What is inflammation? Okay. It's a normal part of our bodies. When we fall and hurt ourselves, what happens? We get a little lump. That's inflammation. That's swelling. It's painful. That's your body's normal response. Blood cells rush to that area, bring nutrients, heal it, and then the inflammation goes down and goes away. That's the normal process. So, let me talk about the picture. So this is a great picture. So you see the normal artery, it's open. Blood can easily flow. But the artery with inflammation, so that's where a lot of the inflammation for sickle cell is noted. Not only in our liver, our kidneys, our brains, our lungs, our heart, but also in the blood vessel. Because what happens is, I explained this a little bit last week, but because of the physiology of sickle cell, your body is in a constant inflammatory state. So the inside of the blood vessel is narrow. You can see this cross section right here. You can see how narrow it is because the tissue around it is so inflamed. What did we talk about last week? We talked about cells sickling. And those sickle cells are rigid and brittle. They don't squeeze easily and pass through blood vessels like the normal red blood cell would. So now that it's brittle, it gets stuck in that inflamed area. So you can see it's already small. It's now inflamed. The cells are sticking together. Nothing can move past that. Thus, you have a vaso-occlusive crisis because blood is not flowing through that area because it's small, and then the blood cells are sticking together, so no blood flows past that. Next slide, please. At any time you have a question, ask. What happens in sickle cell that causes this constant and chronic inflammation? Hemolysis sounds like a big word. Hemo is for the cell, lysis means to cut. That's what happens. Our blood cells are fragile, they break apart. All that stuff that's in the cell should stay in the cell. But once it's out of the cell, it's quite toxic. Okay? That sets up an inflammatory response to all that stuff that's going on. What else happens? It says up there, endothelial activation. All that means is the endothelium is the inside lining of the blood vessel. That's all that means. What happens? The cells break apart, all that stuff that's in there that shouldn't be in your bloodstream, now your tissues are exposed to it, it's an irritant, it starts to swell. What happens? The sickled cells are so fragile and brittle that they basically nick the insides of your blood vessel. That sets up an inflammatory response. This is going on constantly. So that's why sickle cell is considered a chronic inflammatory disease. So acute, that's the first type of inflammation I described. You fall, you hit your arm, it swells. That's acute. It happened right then. You treat it, put some ice on it, what have you, it goes down, you're good. Chronic inflammation lasts months to years. As I said before, that's sickle cell. And it starts in infancy. When you notice, we have children who come in with their first pain crisis between 5 and 9 months old. Why is that? Because when they're born with fetal hemoglobin. Fetal hemoglobin doesn't sickle. But as the baby ages, fetal hemoglobin, the signal to create fetal hemoglobin is shut off. Because once you're born, that signal is shut off. Fetal hemoglobin works when you're in the womb, basically. But once you're born, the signal is shut off. Now we're starting to make adult hemoglobin. But your adult hemoglobin is altered. So you're making sickle hemoglobin. So around 6 months, you see the fetal hemoglobin that doesn't sickle go down, and the adult hemoglobin, the normal hemoglobin, goes up. But if you have sickle cell, it's not normal hemoglobin that's rising, it's sickle hemoglobin. So that's why around 6 months old is when we first start seeing children coming in with pain crisis.
So that's when they see it in their hands and feet.
Hands
like
and feet,
yeah.
Exactly. They get swelling of the hands and feet. Okay? All right. So this starts then, and this is a lifelong complication. Kidney disease in sickle cell is caused by inflammation. It's caused by the damage of those blood cells that flow through the kidneys. Retinopathy, eyes, is caused by inflammation and the damage that the cells do to the blood vessels of the eyes. So that's why it's important to really be up on your visits, because they want to make sure that these things do not happen, and if they begin to happen, we can correct them sooner rather than later.
You know, that's actually how they found out I had a stroke. They didn't see it on the MRI when they did that.
Okay.
When I went for my eye test, she saw it in the back of the eye.
The back of the
She's like,
eye.
you had a stroke? I said, yeah, I told them I had, but they said they didn't see it. She said, no, I can see it on the back of the eye, but you actually did have a stroke.
Mhm.
But she said, yeah, that's why you
That's
come
the
in
way.
regularly.
Yeah. What?
I went to the doctor yesterday, the eye doctor.
Okay.
First visit, and
Okay.
he looked at retina. He was like, "Oh, I see sickle cell." I said, "What?" You said, "What now?"
Yeah.
I was like, "How do I get rid of it?" He said, "No."
You
I was
don't.
like, "What?"
You don't.
But it was. I was like, "Are you sure you looking right?"
Yes.
Because
Yeah.
he said it could have happened during the
If you
pain
repeat
crisis.
the
So it was
question,
6 months.
Oh, yeah. So your question, it wasn't a question, it was an observation, actually. But what you said was that you went to the eye doctor, and the eye doctor, through the exam, could see that you had sickle cell disease because they saw the damage that it had done to the backs of your eyes. That's why it's so important to go and have annual eye exams.
Yeah.
We start those exams at 10 to go to the retinal specialist. So all these things they can take care of before you get older. But I'm glad you went. I'm glad you went. I'm glad you were diagnosed. You know,
Yeah,
finally.
I go to the eye doctor every year, but I guess with an untrained eye again, like. they
So
said,
do you go
yeah,
to an eye doctor every year, or do you go to an
Ophthalmologist.
optometrist?
Yeah, optometrist. So this was.
So
the
this
first
was the
time.
first time you went to an
Yes.
ophthalmologist.
Very different appointment.
Very different appointment.
Yes.
Very different appointment. Yes. Yes, ma'am.
Justin's statement adding to that, like, with her just finding out and me sharing with her, I was telling her, make sure you go to all of your appointments, all of your checkups and stuff like that, because they can find stuff and stop it or find stuff and it'll explain things. 'Cause like,
Correct.
the eye thing, for me, I have hearing loss. And they're saying mine's come from when I first started having sickle cell crisis when I was 6 months.
Okay.
I had a lot of ear infections.
Yeah.
And I always complained about not hearing people,
Yes.
but I would pass the regular hearing test. The beeping, I would pass the regular one they would do at school. They had to put me in the box for.
You did a threshold.
Exactly,
Yes.
and then from there, they were like, you actually have hearing loss. And they actually connected it to the ear infection, and then they also said some of the medications we take too can also affect
Correct.
it.
Yes, absolutely. Wow, good point. Thank you. Next slide, please.
A question real quick.
Sure.
What medications cause your hearing loss?
It was the ear nose control doctor, but then I talked to the ear one, but some of the pain medications.
Really?
Yeah, but
I know
all of
some
the pain
antibiotics.
medications, and she also, the hydroxyurea.
Hydroxyurea.
I was taking a ton because that's basically a small dose of chemo. So,
Let me look at that. All right, so these are the medications that we give for inflammation, is the NSAIDs and Adactio. NSAIDs are a good thing when used in moderation. Many people take NSAIDs and end up with kidney disease because we take them so frequently for our pain crises. These are the first things that maybe a doctor may say, well, try the NSAID and then go to the opioids. But because you cannot take NSAIDs chronically, and that's one of the things that, doctors are trying to figure out, healthcare professionals are trying to figure out what can you use in place of that. Because we have adult physicians who tell us that we've basically sent our pediatric patients to them with already beginning stages of renal disease because we prescribe NSAIDs as sometimes the first step, because some kids don't have a lot of pain and the NSAIDs help. But it also comes with its drawbacks. Adactio is a new medication. It's IV, given once a month, and it's to help prevent the stickiness of the cells. And when the cells don't go through their normal process, it helps reduce the inflammation that's present. These are food sources, and those are just some of the food sources that you can get anti-inflammatory benefits from. These foods help basically break that cycle of inflammation. They work on substances that are produced in the body as response to inflammation and injury. And it's in the foods. It's in the foods. Meryl will go over all the foods that are major players in this. So, sickle cell is an inflammatory disease. It's a vascular disease. It affects our veins and arteries. It's not just a disease of blood cells. It's acute and chronic pain. Chronic pain is the hallmark of the disease, but you can still have some acute pain in there as well, and an acute inflammation. There's many disease processes. We talked about it. We talked about hemolysis, the breaking down of the cell. We talked a little bit, because we'll get more into it next week, about oxidative stress and injury, constant injury in that blood cell, that blood in the blood vessel. And then there's medications and foods. That's what we're here to talk about, foods. Because there's one thing we talked about briefly last week when I mentioned chemotherapy and how the first chemotherapy was made from tree bark. When they isolate meds, when they isolate these drugs, even when they isolate vitamin C, so I'm going to give you an example of a green leafy vegetable. Let's take kale. Kale has vitamin C, kale has vitamin A, kale has iron. And it's all in there in the appropriate proportions, so that when you eat kale, you're getting all of that. But when you take an iron tablet, what do they tell you? Well, when you take iron, make sure you take a vitamin C tablet with that, because vitamin C helps iron absorb. But if you eat kale, it's all in there, right? That's the purpose of this class, is to teach you those kinds of things. Okay?
I was going to say eat kale.
Eat kale. Any questions? if you have questions, you know, you can ask while we talk. And now my coworker, partner in crime.
Thank you very much. Well, hello, everybody. Thank you so much for being here. Jocelyn opened us up on a great note. So I'm here to really talk about food and food as medicine. And every day of my life, this is what I do. This is my full-time job, helping people eat more fruits and vegetables. What a life I have. It's pretty wonderful. So Jocelyn already told you about how to calculate how much water you should aim for drinking per day. So I want everybody to do that exercise. It's math, it is, right? So you can probably do it in your head. How much do you weigh? Got that number? Cut it in half. Got it? That's how many ounces you're supposed to drink a day. Aim for that, all right? So Ryan, just because I know I can pick on you, how many ounces should that be a day?
85.
Beautiful. Kenzie, because you're next to him, too bad. How many should that be? Okay, good. Iman,
62.5.
beautiful. So that's how it is, right? We have supplied some water bottles. I believe those are about 17 to 20 ounces. So if it's 62, let's say you're drinking 3.5. Okay, all right, good. Keep drinking, right? For you, you said 80 something, so about 4.5 of those water bottles in a day. I never grew up drinking water. We had soda, we had milk, we had orange juice. We had maybe iced tea sometimes, maybe lemonade sometimes. I never drank water. As an adult, now I know. In all kinds of ways I know, and my body will tell me
Yeah.
in lots of ways if I'm not drinking enough water. So water is important, and especially in the case where you're trying to stay hydrated, because you need as much fluid component for your blood flow as possible in the case of sickle cell. Okay, next slide, please. So, did you guys cook the meal that we made last week and we sent home groceries? How many people actually put it together? Iman. So how did it go?
It went well, and I also put the big squash and the other one in there.
The big,
It was a little sweet. The skin was a little tougher, so I cooked that one first before I added the zucchini, but it turned out real well.
really good. All right.
His sister said, so I can confirm that this was great.
And my husband actually ate it, and he's a meat eater. I took pictures of him. He was trying not to show that he liked it, but he's like, he went back and ate 3 of them, so I said, yeah, I know it's good.
Yep, you didn't even have to say anything, just going back for thirds. That's great. So for the rest of you, what stopped you? What got in the way of you actually cooking the meal?
For me, just eating other leftovers, I have a problem with finishing off other leftovers, so I try to finish off the others before I make more, and it's an extra soup, so we're trying to finish off soup.
Okay, well, hopefully you'll get to it this week. The fresh fruits and vegetables will not last forever. You know, they are highly perishable.
Mine actually, I talked to her, and she gave me some tips for that. Yeah, she told me to cut it up and freeze it.
Good answer, good answer. Anybody else? What's stopped
I
you?
didn't feel like it was a very hot week, so I modified. I usually had at home. I did do like spinach, broccoli, zucchini. This was my first time I gone to the school at home. I actually enjoyed zucchini. I ate a couple pieces raw before I saw the taste, and I was like, okay, this is different. It's not bad. I was proud of myself.
Really good, you know,
No meat.
that brings up a really good point. I do the same thing. I have a refrigerator full of stuff and I need to use it up before it rots, right? You can go on your phone, go to Google, put in whatever ingredients you have and hit search, and you'll get recipes that include what you already have. You may have to doctor up the recipes. I can't swear that all the recipes are wonderful, right? But you can make things work that way. Okay, great. All right, next slide, please. Does anybody have any questions up to this point? Good. All right, so last week we talked a little bit about label reading. And what I said basically is ignore the front of the package. It is a sales page. It's a con job. okay? They will put anything on the front of a package. So for instance, here we have Honey Nut Cheerios. Doesn't that look healthy? Right? You can go like the colors, it looks so earthy, it's got honey, it's got nuts, it says lower cholesterol, fabulous, right? Looks great. But if we read what's in it, do I have glasses somewhere in this world? It's always the question. Somewhere in this world I do. Okay. So we have whole grain oats, that's great. Second ingredient is sugar. Then it's cornstarch, honey, brown sugar, syrup, salt, and then tripotassium phosphate, canola and or sunflower oil, natural almond flavor, vitamin E, added to preserve freshness. So what we gotta remember is when we're reading ingredients, the names appear in order of quantity in the product, right? So
have most.
whatever has the most goes first,
Right.
and the least is at the end.
Oh, okay.
So in this case, it's whole grain oats. Well, that's lovely. That's a good thing, right? Next thing is sugar.
Yeah.
Just so we are keeping it, we're talking about inflammation, right? Sugar causes inflammation in the body. So to eat something that has sugar as the second and even up to the fifth ingredient, that's a lot of extra causes for inflammation that you're loading in. Thinking that you're eating healthy, because it says so, but there it is, all right? In this case also, you have sugar, honey, brown sugar, syrup, all of those are sugar. How much sugar do you need?
Yeah.
Okay? So the box is, they're designed to sell products. That's really what it's about, selling the products. I don't know if I told you guys this last week, but food scientists are paid millions and millions and millions of dollars per year to come up with perfect flavor combinations that are actually just different combinations of those kinds of ingredients, very low quality ingredients, and sugar, salt, and fat. Perfect combinations that make perfect flavors that hook people, get you addicted to the product, and keep the food company making money. Keep the product flying off the shelf. That's what they want. They're there to serve their investors and their owners. They're not here trying to make anybody healthier, feel better, or anything. They want you addicted and they want you to keep buying it. Okay? All right, here's another one. Muffin mix. Yum, protein packed. Again, sales page. Looks earthy, looks wholesome. It's brown and black, right? What's in it? 100% whole grain wheat flour, cane sugar, vital wheat gluten, 100% whole grain oat flour, semi-sweet chocolate, which is sugar, unsweetened chocolate, cocoa butter, dextrose, which is more sugar, sunflower and or soy lecithin, molasses, which is more sugar. Wow. Cream of tartar, sodium bicarbonate, natural flavor. Not particularly healthy. Not the worst, but could be a lot better, right? And again, ingredients in order of quantity, okay? All right, we're gonna compare these two now. Veggie rotini, come on, that's gotta be healthy. It's got veggie something in it, right? All right. Durum wheat semolina. Wheat flour. Dried carrots, dried tomato, dried spinach, niacin, ferrous sulfate, iron, thiamine, mononitrate, riboflavin, and folic acid. So this is basically a refined wheat product with all of the healthy ingredients stripped out, and then a sprinkling of these other things put back in, so they can look healthy, and it can be red and green, right? You do yourself better getting something like this, ingredients, whole durum wheat flour, period, whole grain. And then just get yourself some carrots and some tomatoes and spinach and eat it. Make a salad or cook it in, okay? really good. Right, one last thing.
Question.
Yes,
How would you know, like, what was the indicator that that brand of pasta is better than like the veggie pasta?
so the question is, what is the indicator? That's a great way to put it, that one brand is better than the other. The only way you can tell is by reading the ingredients. There's no other way.
So what is it about, I guess I missed, what is it about the green one that makes it not, like, that is problematic?
What is problematic about this green one? That it's made with a refined flour.
Oh, okay.
All of the health, the bran is taken out, the germ is taken out. They stripped it down to just straight carbohydrate, simple carbohydrate, white flour, which is empty calories. They stripped it down to that. They sprinkled back in some iron and some thiamine and some other, other nut vitamins, minerals. And then they sprinkled on some tomato powder and some spinach powder.
Okay, so we want to look for like whole wheat flour.
If you can, or you can get something like garbanzo bean pasta, there's lentil pasta, there's black bean pasta, soybean pasta, all red lentil pasta, chickpea pasta is garbanzo bean. Those are whole ingredients that have been dehydrated and ground and turned into flour. And again, those have all the nutrients still there. This has all the nutrients taken out, and then a sprinkle put back in. Out of like Jocelyn was saying, if you eat the fruit, the vegetable, the bean, the nut, the seed, the whole grain, as it occurs in nature, like you just pulled it off the tree and pulled it out of the ground, you're getting all the nutrients that are supposed to be there. By the time a person comes in, takes a stalk of wheat and pulls all of the healthy stuff out and then adds a little sprinkling back, you are doing yourselves no favor by eating that way.
For your question with that, when I first started reading the ingredients, it was hard for me to tell the difference. So I used this app called Food, and you scan the barcode and it grades it and it will compare it and show you like how she just broke it down, and it'll grade it like A, B, C, D, and tell you which one is healthy.
What is the name of the app that you use? Fujikit?
Like educate, but with food in front.
Fujikit.
Fujicate, yeah.
Okay, got it. That's good. No, thank you. That's great. Okay, next slide. All right. I want you to read this label. That's a horrific label. I want you to read it and tell me what in there is real food.
The enriched flour. Is that real?
What was
No.
the question?
What is the real food ingredient in here?
What's the real food?
Is there a real food ingredient?
Would it be the soybean and the palm oil?
Okay, so we have a vote for enriched flour.
Take my vote off.
No, it's okay. We can talk about it. A vote for soybean and palm oil.
Wheat flour.
Salt.
Oh, salt.
Is it the soybean?
We had that one. We have a vote. We have 3 so far. Soybeans included in
Oh,
one.
that's it, okay.
Yeah.
Remember to hear.
Okay, that's okay. Soybean on there. You got it.
And it hasn't been manipulated like in a lot of ways over the.
Correct.
Okay.
Yeah. Okay, let me put it another way. Is there anything there that you could go and pick off of a tree
Okay.
or pull out of the ground?
Okay.
Let's try it that way.
No.
Not a dang thing on there. I don't even know what that is. What would I make in my kitchen that looked like that?
Pop-Tart.
Pop-Tarts, maybe. I was thinking it might be like Lucky Charms. Maybe it's something like that with the colors and the wax, carnauba wax, and it's got some artificial colors and flavors. It's got gelatin.
Yeah.
It might be. It might be something like Lucky Charms, right? But nothing about that, honestly, is real food. Nothing. There's nothing there that would naturally be picked. You can't pick any of that off a tree or pull it out of the ground or find it on a bush somewhere. You cannot. So when we start eating things like this, and this is why it's important to read the labels, when we start eating things like this, we are causing inflammation in our bodies. And it can play out in sickle cell. Jocelyn just described what happens there. And somebody who doesn't have sickle cell, or who only has trait, it still causes inflammation in the body. Causes pain in the joints, pain in the tissues. It's not nice stuff. These are what we call low quality ingredients, very low. They were invented in a lab. These are not real foods, okay? All right, next slide.
That's scary.
Yeah, it is. And that's what we eat all the time. I have to take these earrings off because I think they're banging on my microphone. All right, so this is another way you can look at foods, and you actually have this sheet, I think. Maybe you did, maybe if there's more of them on the table back there. Bree, could I ask you to pick up these on this table with the aprons and just hand them to people? It's a copy of this, okay? So you have it. But just so you have an idea, look out for seed oils, like grapeseed oil, cottonseed oil, even in some cases avocado oil. These are highly processed. There's nasty chemicals they put into the food, into the original food, to pull the oils out. And then they do a whole bunch of processing and create the oil. Olive oil is one of the very, very few. I don't even think they can do it with coconuts, but they can press it, cold press, no heat, to get the oil out, right? So olive oil is still seen as okay to use. So watch out for the quality of those. We already talked about whole grains. When you're looking at a label, make sure that what you're looking at, when you're reading the ingredients, it says either whole grain, cracked, rolled, sprouted, stone ground, or kernel or whole meal. It'll say something like that. If it says refined, or if it just says wheat flour, it means it's highly processed.
Okay.
Not worth eating, gonna cause more problems for you, yes.
So the watch out for low quality oils, if I were to just buy straight grapeseed oil or avocado oil, is that still a no?
Still not the best.
Okay.
Still highly processed with lots of nasty chemicals added to pull the oils out.
Okay.
Extra virgin olive oil is really still the gold standard.
Can I touch on that for a second?
Sure.
It's really like she said, in the process of like the applying the heat to it to be able to extract it. When you apply so much heat, especially when you go through the cooking process, it releases carcinogens into the food. So as over time, it becomes more and more toxic to you.
Yeah.
Thank you.
So some terminology, carcinogen means it's causing cancer, right? No need to do that. Don't do that to yourself. I mean, there's no guarantees anywhere, but definitely don't do it to yourself on purpose, right? Okay. And then just everybody has a phone on them, right? Okay, do me a favor, quick Google exercise. Google how many names are there for sugar? How many different names are there for sugar?
How many names for sugar? Over 61?
Yes.
Lord.
I've seen as many as 75 different names for sugar. So on a label, it could say sugar, cane sugar, raw sugar, molasses, treacle, honey, all kinds of names, corn syrup, just all kinds, right? Date syrup, coconut sugar. There's all kinds of names for it. And then there's other names that you wouldn't know are really sugar, but they're calling them somewhere else, something else, okay? Sugar, again, causing inflammation in the body. This is a list of antioxidant and anti-inflammatory foods. So when you're out shopping, lean toward these.
Okay.
They'll do you a world of good, right? These are like if you wanted to, you've heard of detoxing, right? If you eat this way, whole foods, plant-based primarily, all the time, you don't have to worry about detoxing. You're detoxing all the time, every day with what goes in your mouth. And then you drink lots of water and it helps flush it all out, okay? So these are literally food is medicine. I can't say it any other way. Okay, so you have the fruits, you've got dried fruits, there's vegetables. Herbs and spices in particular are medicinal, honestly medicinal, right? That's what Jocelyn referred to earlier. So for example, in the world of anti-inflammatory, cinnamon is well recognized. Curry powder also, turmeric also, ginger also, garlic. Okay? So if you are having, let's say, and I actually do this, I'm having pain in my body, or I'm starting to get a headache, I will intentionally take cinnamon, ginger, turmeric,
I'll make a tea out of it.
make a
That's
tea,
yeah.
or I'll eat curry,
Yeah.
which is a combination of all those
Yeah.
things, right? Puts out the fire and brings down the pain in my body. And sugar, if I eat too much sugar, I can feel it in my body. So like I said last week, we are not recommending that everybody here go 100% whole food. We don't want to put anybody at risk of any kind of issues with protein levels or anything like that. However, that being said, in the general population, if you're going to eat, this is the size of a serving.
If you're gonna work.
Eat meat, animal products. This is a serving size. Something like the Palmer. It is not a T-bone steak. It is not a rack of ribs. It's this much. Just so you know. 3 to 4 hours. I think it's 3 hours. Okay? That is that story. Okay, we can go on back and get started.